Hello everyone, I am Dr. Shobhit Gupta, Plastic and Cosmetic Surgeon at Shobhit Aesthetics, Karol Bagh, New Delhi. In this video, I'll be walking you through the complete procedure of a chin implant surgery step by step. This is a patient, a professional model who was concerned about his small chin which affected the balance and definition of his facial profile. He wanted a stronger and more structured jawline that would look natural and masculine. After careful analysis of his facial proportions and profile angles, we decided that a chin implant would be the most effective and permanent way to achieve a well-balanced and defined lower face. Precise markings are made on the chin area before the procedure. This step is crucial as it ensures the implant is placed perfectly in the midline and maintains symmetry on both sides of the face. We also mark the incision site, which can either be inside the mouth or just under the chin. In this case, we chose a small incision under the chin to keep the excess controlled and the scar almost invisible. The procedure is performed under local anesthesia, ensuring complete comfort and a pain-free experience for the patient. Once anesthesia takes effect, the chin area is cleaned and draped in a sterile manner. A small incision, around 2 to 3 centimeters long, is made carefully under the chin crease. Through this incision, we gently create a precise pocket over the chin bone. This is where the implant will sit. It's very important to keep the pocket symmetrical and perfectly positioned to achieve natural results. The implant used here is a medical grade silicone implant designed to match the patient's anatomy. It is soft, flexible, and completely safe for long-term use. Once the pocket is ready, the implant is inserted carefully and adjusted to sit perfectly in the midline. We check the projection, symmetry, and overall facial balance from different angles to make sure everything aligns naturally with the patient's features. At this stage, minor adjustments are made if needed to fine-tune the contour and ensure both sides are even. After confirming the ideal position of the implant, the incision is closed using fine absorbable sutures. Since the incision is placed right under the chin, the scar remains well hidden and fades with time. You can see the result immediately after surgery. The chin now appears stronger, more defined, and in perfect balance with the rest of the facial features. This subtle enhancement brings a significant improvement to the overall facial profile. Mild swelling is normal during the first few days, and as it subsides, the final contour becomes even more natural and refined. The patient can resume light activities within a few days. The results of a chin implant are long-lasting and the implant feels completely natural once healing is complete. This is how a chin implant surgery is performed, a safe, precise, and highly effective procedure for enhancing facial harmony. Thank you for watching.